Hi, I'm Dr. Robert Young here at the PH Miracle Living Center, and it's my honor to introduce to you my friend and colleague, Dr. Ben Johnson. And Dr. Ben, we've been working together now for several years here at the center, as well as Universal Medical Imaging Group, where we do thermography and ultrasound. And the thing that's so wonderful about Dr. Ben is he is a unique doctor that combines integrated medicine, both allopathic and naturopathic medicine. He's got 3 degrees. He's got a medical doctor degree, he's got a DO, and he has a ND too as well. And so, Dr. Ben, you know, I'm so grateful to be associated with you, and I'm so grateful to be able to share you with all of those who are going to see this video, because I want them to know all about you and your qualifications and just some of your history, because you've helped so many people around the world, and you've got just an incredible heart, and I think that's why we connect, because we not only love medicine, we love helping people too.
That's what it's all about, is giving to people, taking care of people, helping them to get well, because if you don't have your health, you don't have anything. And that's why it's been such a pleasure working with you with a common goal of helping people get well through integrative medicine and the best of both worlds. So, you know, the medical degrees, the osteopathic medical degree, the MD, and the naturopathic medical degree have allowed me to bring so much different information and bodies of knowledge to the table, so that in my integrative oncology practice, I'm able to offer everything from homeopathics to herbals.
Wonderful.
And yes, if there's a need for standard medicine, low-dose chemo, or insulin-potentiated therapy, then that's available also. So it's being able to bring the best of everything together for one common purpose: healing people.
Yeah.
You and I both know there's no greater joy than helping someone regain their health.
Oh, you're bringing tears to my eyes. This resonates with me. And isn't that what oath you took, the Hippocratic Oath, where you know, first we do no harm. And I mean, you have everything on the list, but I think what's on top of your list? If someone has a health challenge, I mean, are you going to suggest something invasive, or are you going to suggest something non-invasive?
You know, we kind of do it backwards in America and a lot of the world, and that is, we start with the most aggressive, most possibly damaging things, and then if that doesn't work, then people go, oh well, let me try this. And we need to reverse that order. Let's try the least damaging, the least invasive first, and we can always resort to the damaging things later if it becomes necessary.
So everything's on the table. Nothing comes off the table, but you're going to encourage your clients, your patients, to do things first that will balance the whole body and restore health and vitality, rather than just start attacking the body with, let's say, chemotherapy.
You know, there's an order to the universe, there's an order to everything that we do, and we need to bring order to treating people too. You have to include some things that actually may be uncomfortable, emotional issues, even spiritual issues. But, you know, core things, what we eat, what we drink, how we think, and yes, homeopathics, and yes, herbals and nutritionals, and yes, medicine, whatever it takes. But instead of just doing one thing, let's take care of the whole person and be complete.
So you have a holistic approach rather than focusing on any specific disease. Is that what I'm hearing?
You know, it's you heal the patient, and all their diseases will go away.
Yeah. Well, that fits into I think both of our philosophies, that you know, sickness and disease is a symptom of imbalance, and when we restore that life force energy and that alkaline balance, this is when we enjoy the greatest quality and quantity of health. And this is why I'm so excited to introduce this man, because he's got a huge heart, and I want more people to contact him, because he has just a reservoir of information that incorporates all options that you would have. Whether you're dealing with diabetes, whether it's MS, or whether it's depression, or whether it's cancer, whatever the symptom is, these are just names, let's say titles, that really are represented in states of imbalances. And with this whole switch of putting, the non-invasive things up front, and let's do the least harm possible. And then if we have to, we can add some other things into the protocol. I just think it's a beautiful relationship. And, for me, Dr. Ben, integration and working together and cooperation rather than competition, and rather than thinking outside the box, but making our box bigger to include everything.
Robert, why do we need a box?
Well, you don't need. Okay, let's break out.
Do away with the box.
Well, I'm just saying that's just a metaphor, because someone's saying you got to think out of the box. You've probably heard that before, but I don't think you need to give away anything that's good. We just need to add in those things that are good. They're going to benefit you with a holistic medical naturopathic doctor that's going to help you incorporate all of your options regardless of your particular condition. So, Dr. Ben, thank you so much for being part of our team and helping so many people around the world.
Thank you, Dr. Young. You're amazing, and I appreciate all that you bring to the world and to health.
Well, it's only because of people like you that we make each other better.